Here in the office environments, it's recommended that every once in a while we get up, stretch our legs, and rest our eyes for a little bit. It's about that time, but as opposed to going alone, I'd like you to bring you along with me. So in the words of Aerosmith, walk this way. Here at Aureus and Imaging, we have about 250 open positions on average every single day. But before we can talk to you about jobs, we need to have a completed profile with you within our system to send them out to. To talk to us a little bit about that, we have one of our great recruiters, Sydney Caniglia. Sydney, how's it going today?
Hey, good, Kevin. How are you?
Good. I'm just doing a little bit of an office tour here, talking about the traveler cycle, what it takes to get out to those jobs. But first, they need to have that completed profile, don't they?
Correct.
Can you talk to us a little bit about that and your role in there too?
Absolutely. When the candidate completes their online application, we get in touch with them, start building the candidate's profile, building that relationship with them that we'll maintain throughout their assignment with us, on and off. Get the application, bring them through the process of their references, getting the license certifications completed, where they're wanting to go, what their preferences are,
Absolutely.
if anybody's traveling with them. And then we start going over open positions and getting them over to the account manager and start getting them presented.
And it's all about learning about the candidate, what their preferences are, the jobs that are going to work for them, and getting to that next step.
Correct. What's best for them is best for us and the patients.
Absolutely. So the really cool thing about this as well is with those 250 positions, let's say that Sydney might be out of the office. We have a team of dedicated recruiters over here to talk to you about those jobs so you don't miss out on an opportunity. Now, what happens when you're interested in a position, you want to be submitted and learn more about what that looks like? To talk to you a little bit about that, we have one of our account managers, Richard Tinnerman. How's it going today, Richard?
Good, Kevin, how are you?
I'm doing well, man. So we're going through the traveler cycle and going through some different assignments and, kind of seeing those differences. Well, now we're at the point where they're interested in a job and they want to be submitted. Tell us about your role within that step.
Well, kind of the main role in that step for me is I match up your skill set with the hospital's needs and try and create a good match. So if I do a good job of making sure what you can do is what the hospital needs, then it's usually a pretty smooth process and everyone's happy and patients are taken care of, which is the most important.
Making sure it's going to be that right fit for the facility and for the traveler as well. And then there's things like housing and some of those parts too.
Yeah, that's another thing I help out with is I make sure that you have adequate housing or travel arrangements, basically anything that you need so when you walk into that job, you already have a place set up to go to. You can just go to work like any normal 9-to-5 job. Everything's already taken care of.
And really just hit the ground running, huh?
Exactly.
That's perfect. Very good. Thanks, Richard.
Thanks, Kevin.
Have a good day. So now you're on an assignment. I'm sure you have a lot of other questions about that as well, whether it might be payroll, work expectations. Maybe you're having an issue or question with the facility, and really kind of maintaining that you're having that positive relationship as well. Well, to talk to us about that step in the process, we're going to talk to another one of our account managers, Kim Norton, who's right here. How's it going today, Kim?
Hi, Kevin. Good. How are you?
Good. We're walking through all the different phases of the traveler's experience. So now we're on an assignment. They're working within the facility. Talk to us about, as an account manager, what you do when they're out there working an assignment.
So as an account manager, you can call us with any concerns you have. All your payroll sent through us. All of your housing is coordinated through us. Flights, rental car, so pretty much anything while you're on assignment, concern-wise, good-wise, comes to us.
Wow, even flights and rental cars
Yeah,
too, huh?
we'll take care of it all.
That's fantastic. So again, every single step of the process, you have somebody here working with you and for you. Now we're coming towards the end of your assignment, and I can't even imagine what different types of questions you might have. But I do know someone who does. Her name's Danielle, and she just happens to be right here. Danielle, how's it going?
It's great. How about you?
It's going well. So we're going through all the different phases of the traveler's experience out there. We're at the end of their assignment where they got 4 to 6 weeks. What's happening at this time?
Lots going on. We are going to find out from the hospital if there might be a extension on the table for you. Maybe 4 weeks, maybe another full 13, depending on what the hospital needs and maybe what you're willing to do as well. So if both parties are agreeable, then we'll get you out for this.
For that extension.
For that extension.
No worries. So,
And then if not, then we'll go over the jobs we have available, get you submitted over and presented to those for a smooth transition for your next assignment.
and so then the process starts all over again. Whether it's an extension or whether you're off to another assignment, we're going to be sure that you're putting that job that's going to be the right fit for you. So here at Aureus, you don't have one of us, you have all of us working for you. We want you to experience the difference as an Aureus traveler.